Hello and welcome to this recorded presentation for the employees of Professional Safety Solutions for the Employee Benefits Program beginning May 1st, 2023. My name is Bill Hammond. I'm proud to be your insurance expert. Also available to you is Rhiannon and Anna. Both of them can help you throughout this process find doctors, understand your benefits, claims, issues throughout the year, whatever it may be. For those of you that would like some one-on-one assistance in making your decisions during this open enrollment period, I'd encourage you to reach out to me here by email. Let's set up a time. I'm happy to meet with you and discuss the options. We can include anybody that helps you make these decisions. If you have a spouse that would like to be involved in the decision making or in that conversation, happy to help. Quick agenda, we'll talk about our timeline. We'll talk about our new medical plans. We'll be using Anthem Blue Cross this year rather than Blue Shield. Dental, vision, life, how do I enroll, where do I go with questions? So that's our quick agenda. So first, let's talk about our timeline. Open enrollment goes from March 29th to April 7th. This is the time where you can enroll in benefits, waive benefits, add dependents, remove dependents, change from the silver plan to the gold plan, whatever it may be. Any changes that you make will be in effect on May 1st, 2023. We're asking that everybody complete their enrollment by Friday, April 7th. You'll complete these applications online at our EASE benefit enrollment portal, which we've used for the last few years. We'll do a quick review and tutorial of that during this presentation. So Anthem Blue Cross, we have 8 plans, just like we did last year, 6 PPO and 2 HMO, just like last year. And just like last year, Anthem Blue Cross has 2 different types of PPO plans. The benefits are identical. The difference is the network of doctors. Now, the Select Network, which we'll talk a little bit more about in the next page, is a smaller PPO network. But for those of you that live outside of California, make sure you select the Select PPO plan. The reason why is because the benefits are identical as the full PPO, and outside of California, they access the Blue Card network, which means you have literally the same exact network of providers if you were to choose the full network. So for those of you living outside of California, very important, choose a Select plan, gives you a couple of bucks off the premium, better value, and you can still have all the doctors you need. So again, 2 bronze, 2 silver, 2 gold PPOs. These are 6 plans, but each of them are identical plans. You'll see them as 6 different options in the enrollment portal, but they are identical in benefits. For California employees, we also have 2 HMO plans. HMO plans are going to limit who you can see. They're going to require you always start with your primary care physician, but they also limit the cost when you're using them. So those are our medical plans. Again, why should you choose a Select PPO plan? Well, for those of you out of state, it's lower cost, it's got the exact same benefits, and the provider are the full Blue Cross Blue Shield PPO network of America. So really, really nice option. For those of you that are inside California, maybe you want a PPO plan, but you want to save some money. The provider list is smaller. You got only about 40%, maybe a tick under 40% of the total doctors that are in the full network PPO, but it is a lower cost plan. So here's our benefits here. We have our bronze plan. Again, there's 2 bronze plans, 2 silver, and 2 gold. Our bronze plan is going to be a very low cost plan, but a very high deductible. So $6,850 deductible. All right. Notice your doctor visit benefit is $60 and $80 after deductible. Diagnostic lab and x-ray, CAT scans, imaging, physical therapy, occupational therapy, all these things, hospital stays, emergency room, all these things are after DED, meaning after you pay the $6,850, then you get $60 copay for a doctor visit. Okay, so these bronze plans, while they are going to be very attractive in premium, they really are only good for those of you that aren't planning on using your health plan really at all. It's going to ask you to pay everything out of your pocket up to $6,850. The only real exception here is going to be preventative care, which is a $0 copay for all plans. And the pharmacy plan will give you a $20 generic drug right off the bat. Our silver plan, this is going to be our best value PPO plan. Deductible is still a little bit high. It's just under $2,000, but we've got doctor visits with deductible waived. So $55 is a primary doctor visit, $90 is a specialist visit. Diagnostic labs, this is your blood work. If you get it in an office, it's $20 deductible waived. If you go to the freestanding clinic, it's 0% deductible waived, 35% after deductible for x-rays. And then if you're in an outpatient hospital setting, you're going to be paying your full deductible and then 35%. Okay, so there is some places in this health plan that ask you to pay your whole deductible. What you're looking for with a plan like this is the term DED waived. This means that you do not have to meet your $1,950 deductible before getting a copay. So in this situation, for rehabilitative or habilitative therapy, which would be physical therapy, occupational therapy, speech therapy, you would just pay $55 deductible waived. You do not need to pay this $1,950 deductible first. You get that copay right off the bat. Same thing with Chiro, 50% deductible waived. All the way down here at urgent care, $55 deductible waived. All right. Now you'll see these percentages and these words after deductible. Wherever you see after deductible, you are going to be asked to pay 100% of the deductible for the first $1,950, and then you pay 35% after the deductible. Blue Cross pays 65%, not to exceed $9,100. So what this means is if I'm in a car accident on this plan here, and I'm in the hospital for a week and it's $100,000, I'm going to pay 100% of the cost for the first $1,950. Then I pay 35% of the cost. Blue Cross pays 65% until my $1,950 plus my 35% equals $9,100. So this includes the deductible. So this $9,100 is inclusive of this $1,950. Once I've spent $9,100, that is my out-of-pocket maximum. I pay nothing else for the rest of the calendar year once I've spent $9,100. All right. I don't pay for doctor visits. I don't pay for diagnostic lab or x-ray. I don't pay for prescription drugs, hospital stay, surgery, emergency room, nothing. In a calendar year, once I've hit this maximum number, Blue Cross pays 100% of the cost and I pay zero. All right. Most of what you're paying for in a health plan is this out-of-pocket maximum deal. It is the number in which the deal you've made with Anthem Blue Cross is that at this number, I pay nothing else and you pay 100%. All right. Now notice our gold plan, no deductible. We still have an $8,200 out-of-pocket max. Copays are lower across the board. 30% in a hospital stay rather than 35. Not a big deal there, but again, this max out-of-pocket is where you are saving some money. And then our prescription drug benefit is a little bit better. So notice we've got level 1 and level 2. So when you log into the enrollment portal, you're going to see that there are there's a RX tier flyer that's going to show you that for certain pharmacies, you're going to pay more than for other pharmacies. So level 1 pharmacies versus level 2 pharmacies. There's also tier 1, 2, and 3. There's also a 4th tier of prescription drugs. These tiers are the different levels where the prescription drugs fall into place. So tier 1 is going to be generic drugs. Tier 2 is your preferred brand name drugs. Tier 3 is your non-preferred brand name drugs. Tier 4 will be your experimental drugs, your cancer drugs, your self-injectables, that kind of stuff. So the tiers, all the drugs land in those tiers. The levels, level 1, level 2 here, this is going to be the type of pharmacy you go to. Level 1 pharmacy, you're going to pay less because Blue Cross has worked out a better deal with those pharmacies. They charge them less. They pass along that savings to you. Okay, so we'll show you a little bit about how you become a smart consumer when it comes to finding those prescription drugs, those pharmacies that are level 1 versus level 2. Also, we have a brand name drug deductible, and there's on our gold plan we have none, but on our silver plan we have a $300 individual brand name drug deductible for tiers 2 through 4. This means that before you get these $70 or $110 copays, you must pay the first $300. All right. We're going to see a lot more of this kind of stuff in the future with prescription drugs. Brand name drugs are the #1 fastest growing part of a health insurance policy. Those costs are being passed along to us in various ways in the form of higher copays and brand name drug deductibles. Last thing I'll call out is the individual versus family deductible and out-of-pocket max. So if you're enrolling in one of these plans by yourself, this family number doesn't mean a thing in the world to you. All right. $1,950 deductible, $9,100 out-of-pocket maximum. If you're enrolling with your family, the family would have as much as a $3,900 deductible and $18,200 max risk. This term embedded is important. The term embedded means that it is really two $1,950 deductibles, meaning no one person has ever got to pay any more than their individual deductible. So we'll go back to the car accident where I spent a week in the hospital and it was $100,000 in expenses. I will have met my deductible in full at $1,950 and my out-of-pocket in full at $9,100, and I would pay nothing else for the rest of the calendar year for all covered services, and my family would have the other $1,950 deductible and the other $9,100. So what this means basically is no one person is out of pocket for a deductible any more than $1,950 and $9,100 as an out-of-pocket, and no family unit, no matter how large, is out of pocket any more than $3,900 for deductible and $18,200 for out-of-pocket maximum. All right. Notice how these numbers are lower across the board with our gold plans. Gold plans will cost you more out of your paycheck, but when you use them, they'll cost you less. So think about how you utilize healthcare. Do you have a lot of expenses? Do you have a surgery coming up? Are you having a baby? It might behoove you to buy the more expensive gold plan and keep that deductible as low as possible. For our California employees, again, if you reside outside of California, you are not eligible for the HMO plans, but we have two for those California employees. We have the silver plan. It's going to be a very low cost plan, but a higher deductible. Again, here's our $2,500 deductible. Gold plan is zero deductible. You see our out-of-pocket maximums are higher for silver than they are for gold. Same thing with copays, higher for silver than gold. The big difference is going to be in the inpatient hospital, outpatient surgery, and emergency room visit. With our silver plan, we've got our deductible plus 45%, not to exceed $9,100. But on our gold plan, notice it's a flat dollar copay here. So if I just have an overnight stay in the hospital, I have no deductible and I pay just $750 for that visit. This is really nice. It really limits your expenses. Again, back to those of you that have predictable medical expenses. Gonna have a baby, gonna have a surgery, gonna be, if you're, maybe you do snowboarding or ride mountain bikes or you jump out of airplanes or whatever, maybe you're accident prone, maybe you have little kids that are playing sports and end up in the emergency room sometimes. This managing your emergency room visit with a copay is a really nice way to lower your costs. So again, California employees only, HMO plans. So a couple of slides here on just the different things Blue Cross has available to you. Their mobile phone app is called the Sydney Health mobile app. Lots of different stuff you can do. You can actually get virtual visits straight through the Sydney app anytime, anywhere. So that's nice. Also with the Sydney app, a little bit more information about how you connect with providers with a video visit, board certified doctor, therapist, psychiatrist. There's mental health involved in this as well. These are good options. These are good things to have with our Sydney app. We'll want to make sure you download that. The single most important thing you can do to improve your benefit experience is downloading the smartphone app. So I encourage all you to do that when you get an ID card. Speaking of mental health, the employee assistance program that is embedded into your medical plan has available to you 24 hours a day, 7 days a week, 365 days a year, a wide range of no-cost support services. So counseling, legal consultation, financial consultation, ID recovery, crisis consultation, daily living, senior health care, addiction issues. You can even get up to 3 in-person visits per issue. Okay, so for many of us that are experiencing some things for the first time or being overwhelmed a little bit, which is very easy to do in this world with things that happen with life, with kids, with finances, with addiction, with marriage, whatever it may be, this is a really, really great place to start if you don't know where else to start. And part of their services help you navigate the system so that you can find somebody you can see on an ongoing basis. So this is a benefit that is available to you right away. So let's talk about dental plans. So we have HMO dental plans and PPO dental plans. Here's our HMO dental plans. Again, this is for California employees only. If you reside outside of California, you are not going to be eligible for this. But the Delta Care dental plan, silver and gold, very low cost. It's a decent plan, not a lot of selection of dentists. Again, an HMO dental plan is going to limit your costs, but it's going to limit who you can see when you want to access coverage. So for California employees that just maybe want a couple of free cleanings every year, this is a really great place to go. For those of you that are outside of California, or maybe you're in California but want more selection, we have 3 PPO dental benefits from MetLife that are available to you, our Gold, Platinum, and Platinum Plus. The biggest difference between a PPO dental plan and an HMO dental plan is your calendar year maximum. Also, of course, the number of providers you can see. The MetLife PPO provider list is, 4 or 5 times larger than the HMO provider list. So for those of you that want a lot of choice, your PPO dental plan is going to be the way to go. Notice our Gold plan has a calendar year max of $1,250, Platinum $2,250, Platinum Plus $2,500. This is important because once MetLife has paid, if I'm on this Platinum PPO plan, once they've paid $2,250 of dental expenses towards my needs in the calendar year, they will pay no more the rest of the year. So this calendar maximum is completely different and opposite from what we saw with medical. With medical, remember they said, once you hit this number, you pay nothing else and Blue Cross pays 100%. But in this dental PPO world, calendar year max is the other way around. Once MetLife has paid out $2,250 or $2,500 or $1,250, then they pay nothing else and you pay 100%. All right, so that's important. Also, they really divide everything up into 3 different categories. Preventative, they pay 100% of it. Basic services like cavities, like root canals, they're going to pay 80%. The Platinum Plus pays 90%. And then for major things like crowns and surgery, you're going to pay a 50-50. All right, so that's your PPO plan. You would want to search the PDP Plus plan through MetLife.com, and that's how you could find a provider. So our vision plan through VSP, we just got the one plan. It's VSP. It's called the Choice B 15/30. When you need an exam, every 12 months, you get a $15 eye exam. For those of you that want frames, there is a $180 allowance for frames or $200 allowance for some featured frame brands. You get this benefit once every 2 years. If you need new lenses, you get that benefit once every 12 months. That's going to be part of the $30 copay. Enhancements, of course, every 12 months. Here's some of the prices there. If you want contacts instead of glasses, you get that every 12 months. You'll pay as much as $60. So this is your vision plan for those of you that have glasses that want to access vision benefits. This is a really nice plan. Doesn't cost a whole heck of a lot, and it's good for you. For those of you that don't have any needs, this is a great benefit for you to skip and just waive the coverage, which you're free to do. When you are searching for a provider, you're going to be looking for the VSP Choice Network. So we also have available through Unum a couple more benefits. We have a short-term disability benefit. This is paid for 100% by the company. California employees get 20% of your income up to $1,000 a week, and non-California gets 60% of your income up to $1,700 a week. The reason why there's 2 different benefits here is because all of our California employees, you are already paying into a state-based short-term disability product. So the non-California employees have a higher benefit simply to really match what California employees already have. Your employer also pays for $25,000 worth of life insurance for everybody. Additional voluntary term life is available. You can apply for more life insurance if you'd like. If this is your first time enrolling, if this is your first time seeing these benefit options, this is your initial enrollment, you can get up to $40,000 with no health questions. For those of you that have already been through your first enrollment, maybe you were hired this year and you elected not to take any additional life insurance, whatever it may be, you are eligible to enroll in life insurance up to $500,000, but all amounts are going to trigger what's called an EOI, an evidence of insurability. Another term for it would be a health questionnaire. So any amount that you enroll in, if you're not a brand new employee, is going to trigger a health questionnaire. You can expect to get an email from Unum within a week of the May 1st effective date. They will ask you some questions. Many of these extra questionnaires are approved right on the spot, just with your answers. So be on the lookout for that email. Enrollment. So how do we enroll? We're going to be going to our Ease Benefit Enrollment portal. I'm going to just jump into it right now. Here we are. It's our prosafe.ease.com. We'll log in. Once you get here, you're going to see this page where it's going to show you what you chose last year. You're going to look for this green button at the top, Start Enrollment. You're going to hit Start here. This video you're watching is embedded right in here, so you can watch it again if you'd like, or maybe this is where you're watching it for the first time. Continue. You'll fill out all your information. You're looking for these asterisks, so you can continue. Dependents. Load in all your dependents here. Loading your dependents here does not mean you're enrolling anybody. It simply just means that you are putting them in the system so that you can see what the costs are. Most of you do not have Medicare, so you can continue. If you do, you would add that information there. Here we get to our benefits, and because we have a new medical plan, you're going to see nothing is selected here, all right? So lots of people will scroll right past this very quickly, all right? So what you have to do is you need to hit the check mark right here so that you can start to see these little green buttons pop up. It shows me that last year I was on this Blue Shield Silver Full PPO plan. All right. So if I wanted to go back to that, I could go right back to that same plan. We can see here that as we're selecting the enrollment, like I said, these green buttons start to appear as we add our dependents to it. Those numbers will change as well. My election for the Blue Shield plan is a little different, so I'm looking at these different bronze plans. I didn't have everybody enrolled like it did now. If I want to do it just like employee plus spouse, we can put parents group plan, or we can just do other, doesn't matter. If we have a good reason why, go ahead and put in there. Otherwise, you can just kind of put all that information in there. Take our silver PPO plan. Notice we got our benefit summary. If you click here, you'll see the benefit summary. You can see details on the benefits. You can download my mobile app, the Sydney app that we talked about. There's that flyer that you'll be able to download and print and use, how to print or download an ID card. And then we talked about the tiered choice pharmacy network. Here's that document that we'll download at one point or another here. Pharmacy services near you. So this is where you'll be able to understand the difference between the pharmacies that are in the network, the tier 1 versus tier 2, or level 1 versus level 2. So lots of information here. You'll find that in there. Once we choose what we want, we'll choose select. Oh, I didn't choose one. We'll just go with this silver PPO, select PPO, boom, continue. We see our prices are going there. Here's our dental plan. We're all in the same dental plan. Continue. Vision plan. I've waived my spouse and my kid. I just want for myself. This is a nice little note that lets you know that you do not have to elect the same thing for every one of these plans. You can enroll just yourself on medical, your whole family on dental, and just you and your spouse on vision, whatever it may be. Choosing the plans, continue. Short-term disability, this is going to be a factor of your income, and so there's nothing really to choose here. It'll be pre-selected for you and selected there. Continue. Life insurance, again, that's going to be selected for you. Notice it used to be 10,000, now it's being increased to 25,000, so that's a good thing. Voluntary life, here's that note we talked about. First time eligibility. So I chose the 40,000 before. I can also enroll in more for my spouse, up to 15,000 guaranteed. Again, any amount that you choose here that is your second time through or your third time through, or at least not the very first time you are being eligible to enroll, it's going to trigger a you have evidence of insurability or health questionnaire. So once I get all that done, I'll add my beneficiaries. Primary is your main beneficiary. Secondary is optional. This is a secondary beneficiary is who would get the money if the primary beneficiary was no longer around as well at the time of your death. So we've got 3 different life insurance plans. So that's that. Continue. Health information I do not need. It's not going to ask me for anything right now. Continue. This will give me my summary of what I've elected, how much it is. Continue. I didn't open up my summary of benefits and coverages. This was a mandatory document to open up. This will happen to a lot of you. If you didn't open it up, all you do is click here. Once it opens, this is what Obamacare says we have to show you as employees. Once it opens, you'll notice you get back to here. You've done everything you need. Hit continue, sign forms. Then it turns basically into just DocuSign here. You are going to type your signature one time. You're going to use your mouse to sign the document, or if you are using a phone or an iPad, you will use your finger to do it. You'll hit next, and then you'll just follow through, and you'll just drop your signature in all the different places that it wants you to. Just keep clicking these green boxes until you're all done. Just keep going, and then hit finish signing here at the very top. Once you hit finish signing, it's going to give you a chance to download the mobile app if you'd like. You can tell us how your experience was if you like. Just hit finish. It's going to take you back here, and you are all set. There's nothing left for you to do. You'll get the email that basically says, thank you for submitting your elections, and now you know you're all done. So what's next? Be looking for your EASE invitation login. The deadline to enroll is April 7th. If you have any questions, if you need any answers, we'd be happy to help. Our contact information is here. Feel free to reach out to any of us at any time now or throughout the year if we can be of service to you. We are happy to help. We are advocates beyond anything else. So if we can ever help you with anything, please reach out to us. Let us know. Appreciate your time. Appreciate your attention. And it's an honor to be your insurance expert. Have a great day.